My name is Lena Tucker-Reinders. I'm the Executive Director of Iowa Public Health Association, and we put on these lunch and learns once a month, typically on the third Thursday of the month. But this month we're being a little spontaneous and going on the 8th, going on the second Thursday. But we do these as a way to support our members, to support professional education and sharing of what we are doing across the state to improve the lives of Iowans through public health practice. So thank you for joining us today. This series is put on by the IPHA Education Committee. If you are interested in learning more about what the Education Committee does or volunteering on that committee and kind of helping us to plan these events and others, including the Public Health Conference of Iowa, please get in touch with us, either myself or Kim. You can send us an email. Our email is our first name at iowapha.org. And if you, hopefully, most people that are on here today are members of IPHA. If you're not yet a member, and I stress yet, join us. We would love to have you as a member. We are a growing organization, and we are here to support the Iowa public health workforce and friends and make sure that you have the resources that you need. So with that, we have a few more people come in the chat. I think I've stalled long enough though. So let me introduce you to Joy Harris. Joy is a board member of IPHA, and she is working with the Public Health Accreditation Board, or FAB, as you probably know it. And a couple months ago, she sent me a link to a site on Johns Hopkins site talking about trust and rumor busting and infodemiology. And I instantly thought, what a great topic for a lunch and learn. So I asked Joy to present today, and she gratefully said yes. And so, Joy, I'm going to turn it over to you now and get out of your way.
Awesome. Thanks, Nina. It's nice to meet you all. If I don't know you, I do know some of you. I'm excited there's another Joy in the room. That doesn't happen to me very often, that there's someone else named Joy. So it's nice to meet you, Joy. I am not an expert in this by any way. What I am is curious. And what I am is easily excitable about things that I get curious about. And so when I went to this webinar, um, we had been talking a lot as a board about there's so much misinformation in the world and it's coming so quickly. How do we know when to react? How do we know when to stay quiet? How do we know who the right person to answer some of those things is? So I went to this webinar, was super excited by what I heard. I've dug into it a little bit more. I'm going to show you some of the things that I found, some of the tools. A lot of it's what's interesting to me. So I'm hoping it's interesting to you too. Please feel free to interrupt me, put something in the chat. I would love to not just talk at you for this time that we have, but if there's something that we want to talk about, please do let me know. Okay, so the webinar I went to is called Rumor Has It, Communication in an Environment of Misinformation. And it was from the Northwest Center for Public Health Practice. And they do these hot topics series. You can go look at the actual recording. I'm going to use the speakers' slides or some of them as we talk today, but just know none of this is original to me. I am borrowing heavily from what she presented, adding things into it that I've looked at separately. So that was my precursor. So we started that webinar with a term that was new to me, which was an infodemic. And we talked about that we are living in a time of an infodemic, which was new for me. So I looked up the definition. We have it in the Word document that Lena is going to share with you all with the resources from this. But an infodemic is an excessive amount of information about a problem, typically unreliable, spreads rapidly, and makes a solution more difficult to achieve. Felt perfect. I feel like we are in an infodemic. There is actually quite a bit of information out on the web about infodemics that I started to get into. So the World Health Organization has some courses around this, which I thought were kind of interesting. There's also a website called infodemiology.com that has some interesting resources that I'll show you here in just a minute. So let me share my screen. I'm going to jump back and forth between some PowerPoint slides and some websites. So hopefully I won't make you too dizzy as we do that. So this is the infodemiology.com site. If you kind of scroll down, they have different training programs that are available. They have different kind of examples. Some of the resources I thought were really interesting. How AI chatbots are changing the way young people seek mental health support. Really looked at some of the things with AI and information that are out there. There was one around measles that I thought was really interesting. The Tylenol and autism thoughts, those things I thought were all really good. So wanted to be sure that you knew about that as a resource. Now I'm going to jump into the slides from that presentation. So I'm going to share one more time. Does that feel big enough, y'all? Can you see okay?
It does for me, and I'm usually the one that says make it larger. So
Okay, perfect. Thank you, Lena. All right, so this was the presenter. These are 22 of her slides from that day. What she pointed out that I want to point out to you all was that this is, I mean, public health information, health-related misinformation is not new, right? It has been around for a while. It's been a problem for a while. This cartoon here on the right was in the 1930s, showed up again during the pandemic. And IPHA actually had a role in helping kind of debunk the myths around the use of this cartoon. In some ways, that's comforting me and to me that this has been something that we've been dealing with for a long time. In other ways, it's disconcerting, right? I wish that things were more clear and there wasn't as much misinformation in the world, but there is. And so we have to think about how we can address it and hopefully strategically, not just as it comes, but really thinking about purposefully how we deal with this misinformation. So this I thought was really interesting. So she talked about the different types of rumors and that rumors really circulate in kind of three big categories. So around cognition, around culture, and around communication. And I'm going to go back to the website to break this down for you a little bit more. Plus, I think it's clearer. Whoops. Thank you all for your patience with me. So this is the website specifically looking at rumors. And I wanted to show you their three C's: culture, communication, and cognition. So with culture, we're looking at rumors rooted in social, political, and cultural beliefs and practices. So there were a lot of different things that could fall into that. This last sentence I thought was really important. The category of rumors can sometimes recycle existing harmful narratives and link them to new public health issues. Communication was the next big category they put them in, and this is about accuracy and effectiveness of communication. And then cognition was really around rumors that result from how people think, how people take in information, the kind of shortcuts that we use based on previous knowledge that we've had, the clarifying of uncertainty and uncertain risk that people are trying to address by jumping to those quick conclusions, is also part of cognition. So taking it to that next level, looking a little bit at where do they cross over, kind of where do these different types of rumors fall. This was their Venn diagram that they developed about those types of things. So you can see with culture, right, social and cultural narratives, spawn rumors, conspiracy, scapegoating, um, apathy as well can fall in that culture. With cognition, there was that desire for certainty, mental shortcuts, overconfidence and complacency. And with communication, the false cure, manipulated information, lack of understanding. And as I thought about these kind of different categories of rumors and misinformation, it was helpful to me to think about where maybe have some of these things come from. What are they rooted in? And the toolkit that these folks have developed really goes into what are the specific steps that you can take based on kind of the root of the rumor. So if it's manipulated information, there are different techniques that you should take versus if it's a false cure. So it was just not something I'd thought about that deeply before. And so I appreciated that someone had thought about this and really dug into it. It goes further, which I thought was totally fascinating. And there are sub themes within those rumor themes that I wanted to point out. So with social and cultural narratives, right, the sub themes they found were around vaccines, government distrust, politics, sexual and reproductive health, xenophobia. And it goes through each of those different kind of rumor themes and sub. The importance of knowing this is really knowing kind of that strategy of how to address that misinformation and taking the time to not just react to misinformation, but to take time to really identify where it's coming from, what it's rooted in, so that you can be more strategic. There's one more I wanted to show you. So the desire for certainty was another one that I found really interesting. So under desire for certainty, they talked about response, personal risk, and how folks are really affected by those emergencies. The event description itself can be part of that, efficacy, and then long-term effects. I thought that was really interesting. There is a link to this webpage in the resources that I've provided you all. I hope that if you get a chance, you'll take a look. I really thought it was fascinating. Had no idea that rumors could come from this many places. So I again, really appreciated that someone took the time to really figure that out. Any questions about that? Okay, so let's keep going. Thank you all for hanging in with me as we go through my slide changes. So the next area that they talked about was this 4I framework for advancing communication and trust. I didn't dive into this as much as some of the other areas, but it's an overview. With the I's, we're talking about the different kind of mechanisms that you can use to advance communication and trust. And it's at 4 different levels, right? So the information level, the individual level, the interpersonal and community level, and institutional and structural level. And there are examples under each level on this slide. What I really found interesting here is that it didn't really feel new, right? It feels like things that we know, things that we have done, but not necessarily looked at it in this model or in this framework with this kind of organization. So wanted to offer that to you as well. They do have like a quick video on the 4I. There is a toolkit around using the 4I framework, and would invite you to check that out if that's something of interest to you. The Trust in Public Health website is where I pulled this information from. It's what they were doing the webinar, the website, and the resources that they provide. So it's the Center for Health Security, and it's really looking at proactively addressing health rumors to build, strengthen, and maintain trust in public health. And we talked about trust in public health and the way that has changed, the way that it's different, and then how we're going to need to continually be thinking about regaining trust. Some of it's within our control, some of it's not, which is part of it. So within this website, there are several videos that I wanted to be sure that you talked about, as well as stories. So stories from health departments about how they have applied these concepts. And sometimes I think those are more fun to learn than looking at a worksheet or looking from a template. So there are different examples as part of their toolkit from health departments that talk about this. And then you can see the different types of videos. They're pretty quick videos for the most part, and really provide an overview of what's in the toolkit. So the first one I wanted to talk about in a little more detail is this checklist to build trust, improve health communication, and anticipate misinformation during public health emergencies. They're really focused on public health emergencies because of the timeliness with that, because the level of misinformation is a lot of times higher during emergencies. And so really also thinking through what you have normally and how that changes with an emergency, and how you can take what you do in emergency and apply it to what you do with everyday misinformation. Because it happens all the time, right? Not just during an emergency. So this is the checklist, what the resource is. On the next slide, it talks a little bit about the kinds of things that are in the checklist. So the checklist has kind of 5 main priorities for folks to consider as you think about kind of building trust and improving communication. The first one is on focusing on internal operations. And there's several different examples under this of the kinds of things that you could do. Some of it's related to preparing your staff and making sure you have the appropriate kind of subject matter expertise, or a partner that you can call on to help with some of that work. It's really thinking about what alternative resources you might have that might be available to your department. Who else can you call on? It's about understanding the different audiences that you might be working with, and really investing in those kind of relationships. So that really gets into that step 2 around building connections with the community. I think we all know that public health is relational. It's a lot about relationships, and this just adds to steps I think we already know to take to build relationships, to reach out and meet new folks as part of this process. The next step, step 3, is around establishing opportunities with secondary messengers. Secondary messengers could be a lot of different things. It could be folks within schools. It could be prominent community members. It could be a city council. It could be even like a social media influencer that's known in your community. So with those secondary messengers, much like relationship building, and part of relationship building is just meeting with those folks, understanding the kinds of areas that they're interested in, the kind of audiences that they have, and really thinking through in what ways might you call upon them. Step 4, I thought was most interesting to me, around anticipating misinformation and loss of trust in a public health emergency. And what they talk about is things I think are hard as part of this. So the first activity they encourage is enabling appropriate understanding of what public health is and does. And I feel like that's been a question. I've been in public health for a while, and I feel like that's always the question, right? What is public health, and what are its benefits to society that we continue to have to answer? And so it talks about that. It talks about needing to clarify how government services are organized as part of this process, and thinking about how you're going to explain that. It talks about being transparent and explaining goals and thought processes behind public health operations and really thinking through what feedback mechanisms you would use in an emergency. None of that is easy. And I think that that takes time. The next activity was around setting expectations for public health response and communication at the start of the public health emergency. So, really helping people to understand that there are going to be issues of uncertainty, establishing plans, and really thinking about the cadence of communication. Activity 3 in this area was to track, analyze, understand, and plan for anticipated rumors in local contexts. They talk a lot about social listening and different ways that you can collect information about rumors that might be happening in your community. And then finally, in this step, promote use and access to trusted sources. So really thinking through who are those trusted sources, making sure that they're accessible to people and that there are different ways to assure accessibility of communication. Not everyone is going to get that information in the same way. And I see there's a couple of chats coming in, so I'm going to try to get to that because I can't see it right now.
It's mostly me, Joy.
Okay, perfect.
Danielle's asking if we can get the slides, and I presumptively said
Oh,
yes.
yes, you can. All right. Next thing, and there is a link to the slides in that Word document as well. So moving on from the building trust section, they also have this practical playbook for addressing health rumors. The playbook is pretty long. I wish I could tell you that it was short, but it's pretty long. I think it's like 63 pages. But within this guidebook, they talk about guidance for addressing rumors, tools, templates, and examples, and point out over and over that there is no perfect solution, right? There are things to try, and there are perhaps best practices, but it's not always going to work the same way. And allowing yourself and your team that flexibility can be hard and challenging, but is important. Oops, I want to get to the next one. So the playbook itself talks about some different areas. They're similar, but kind of really grow on what we had earlier. So it talks more about preparing for health-related rumors, deciding when to act to address rumors. That was the section that really interested me that I want to jump into with all of you. Determining which actions to take to address rumors, developing messages to address rumors, and then gathering feedback on those messages, right? That evaluation is so important. So I'm going to stop sharing again and switch to their website. One more time. Okay. Looks like you can see now. Okay, so the practical playbook addressing health rumors, helpful tool for practitioners. This is the main page on the website for this tool where you can download the playbook. A couple of things I wanted to point out from this main page. So there's a 2-page overview, which I thought was a pretty concise way to really look at the kinds of things that are included and introduce you to some of the tools that are available. There's that checklist that we just walked through, the audience persona characterization tool really helps you think through the different audiences that you might have. There's a worksheet for developing messages to counter rumors that has some guidance really related to kind of the root of those rumors, message framing strategies and templates, and then there's a decision-making worksheet. So my next tab here, within the playbook, they have this broad kind of overview that I talked about that I really liked. So this is a 2-page overview. You can see each step goes into a lot more detail as you get into the guidebook. The one that really caught my eye was deciding whether to address the rumor or not. So, as part of that, there were three steps. What's your goal for responding to the rumor? What influenced your decision to respond? And deciding whether you're going to address the rumor or not. That there was an or not kind of caught me off guard, and it also felt kind of freeing, right? That maybe we don't have to respond to everything, but we should systematically decide what we're going to respond to. And even if we decide not to respond, it doesn't mean that we shouldn't be aware, shouldn't be thinking about it, and continuously really looking at what our criteria are for when we're going to weigh in on something or when we're not. I just thought that was very interesting, y'all. Um, Here is that section of the guidebook. And it interests me enough, and I hope it interests you all enough that you'll let me go through it for just here a couple minutes. So here's their steps, right? You get an alert, a rumor is going around. What do you do next? So step one was deciding whether to address the rumor. So within that, there's several sub-steps, right? Identify your goal for responding to the rumor, right? What is it that you hope to achieve, right? What is the intended outcome of that? Do you need to understand what it is more? Do you need to make any changes? Do you have kind of the right people in place to answer some of those questions? Is part of that step one. With influence, what influences your decision to respond? They proposed a couple of different criteria. What they encourage you all to do is to think about what are going to be the criteria for your department. I thought this was interesting what they picked. So first, the seriousness of the viral rumor, right? How much is it spreading? How many people is it reaching? Is it hurting people? Who is it hurting? How believable or powerful the person or entity spreading the rumor seems. The next one they had was your capacity to act, right? Is there enough scientific evidence to prove a rumor is false? Whether your institution approves of you responding to the rumor, or whether there's enough funding to develop and share messages. And then reducing negative consequences. So whether unfavorable outcomes could result from addressing the rumor, like accidentally amplifying misleading information, pushing away audiences, making public health workers a target of harassment, or filling in gaps in knowledge with incomplete or incorrect information. It gives us these as prompts. It doesn't say these are the only ones. It doesn't even say these are ones that you have to use. But I liked, again, that they gave us some ideas about really thinking through what is influencing that decision, right? Not that it'd be a knee-jerk decision, but that we've thought about it. And then there's a worksheet that they encourage folks to go through to really think through this process. And there's instructions in this guidebook through the worksheet. I want to share the worksheet with you. It's in a Word document, a little bit easier to see. So I'm going to stop sharing one more time. Again, I'm sorry for all the back and forth. And I want to make this a little bigger for y'all. Okay, so this is the worksheet that they're encouraging folks to use that really gets into more of those criteria that you might consider in responding. So for each kind of area, right, how serious is it? What capacity to act do we have? What are the potential consequences? They've provided some criteria for your consideration, for a department's consideration. Which again, I felt like was valuable. I hope that you do too, or it prompts more thinking on your part about what you might include. So with potential consequences, we kind of talked about some of those when I just did that last little bit. With capacity to act, there was a lot more here that I haven't verbalized to you, but like the workload of the responders is one. The value generated by acting the funding, I had mentioned that, availability of evidence, access to trusted communicators, right? Who are those folks? The amount of time available to act, availability of expertise, the knowledge level of the audience, support from leadership, whether clearance is needed to act, and level of cultural competency. Then from here, they think that you should kind of identify a benchmark, right? What is going to prompt you to make that message, to respond to that rumor? And they propose a couple different benchmarks, but it's really up to you all what benchmark you would use and you would pick. Do kind of what they identified really quickly. Can you go back here? Computer's misbehaving. Okay, so here they have, you could use a mix of quantitative and subjective benchmarks. Measure the spread of the rumor. You could use a benchmark like rumors must make up 75% of health narratives collected by a social listening system, or subject matter experts think the rumor is spreading. You can also adopt more standard benchmarks like those used to declare public health emergencies. I didn't want to go any further into this, but I thought it was cool. I like that someone thought it through. I like that someone was offering kind of a strategy or a way that we could think about this systematically. It wasn't something I'd been familiar with before I attended this webinar. Let me go back to the slides. Okay, so we just did that. They broke it down in the webinar into some broader categories that are part of what we had talked about, right? So setting yourself up for success, right? The pre-work of things you can do before rumors arise, putting together a team, knowing who you're going to call on if this happens, those connections, understanding your audience, really understanding how to identify rumors. They talked about, looking at, there are formal tools that you can get to monitor social media, but also taking notes in community meetings. What are you hearing when you're out in your community? There are different ways with different formalities to kind of set yourself up to identify rumors. And then really encouraging us to think about answering audience questions and concerns quickly. Because delay sometimes tends to make things bigger than they were if we would have handled it sooner. This is how they talk about that. So they use this chart that talks about where we have more influence as communicators and where we have less influence. And it's more common and easier to address questions, concerns, information voids. I like how they put rumors kind of in the middle. And then we have less influence and it's harder to address rumors and false narratives. So also just knowing that was like, yes, that's true. But I'm glad that someone wrote that down. I believe that's true. And then talk about the growth of narratives that if things are sustained over time, there is an increasing potential for harm. And so really thinking about over time, what is the impact? And that could potentially be one of the criteria that you would use to decide about addressing a rumor or not. This is that worksheet that I just showed you. I thought it was really hard to read here, so I wanted to show you the separate document. And with deciding whether you will address the rumor or not, again, that felt really powerful to me. It felt like we don't always have a lot of power. It sometimes doesn't feel like, but really thinking for ourselves about how and when to respond systematically. I just really like that. Okay, so taking action to address rumors. They do really think about identifying the type of misinformation that's spreading, that really thinking about back to that cause, that root that we talked about earlier, characterizing your audience. And then they have different kind of tips for different ways to communicate based on rumor, based on audience. So from there, choosing an action approach, selecting your communication channels, right? You're not always going to be able to communicate in the same way through the same channels. I know I'm preaching to the choir. Strategic ways to frame that message, and then just getting them out into the world, right? Making sure that you have done your best to put them out. And taking action, there's types of misinformation. It's different than rumors, but different misinformation that I also really thought it was important that they pointed out, that I wanted to take a couple minutes for us to look at. So misinformation can be around safety. It can be around efficacy. There is oftentimes changing guidance. The risk or severity of a health condition, the cause of the condition, trustworthiness, how people understand the world around them, that blaming and stigmatizing. There's confusion around a previous message, right? So something didn't go well the first time and that created more confusion. And then that desire for certainty when the situation is uncertain. So with this kind of knowledge of what this is and what it gets to, as well as the type of rumor, you are, according to this toolkit, better able to kind of strategically think about your communication. There are different audiences in general, right? There's general audiences. There are going to be people who are disproportionately impacted. There's going to be people who are going to be more likely to believe it, and there's going to be people who are spreading rumors, right? There's partner organizations that most likely you already work with or know of that are going to be working in amongst all those different groups. And so really helping to build on those partnerships is important across the board. With an action approach, so this really summarizes what they have in the toolkit into a couple of bullet points. But broadly, these are the choices that they talk about. So amplifying accurate information, filling information voids, leveraging those trusted messengers, engaging communities, the refute, fact checked, or debunk process, the pre-bunk or inoculate, I thought was really interesting. And then improve health and science literacy. No small feat, right? Improving health and science literacy. And then with channels, these are some of the things that they talk about in the toolkit and provide guidance on around channels that you can use. These three are most prominent, right? In-person, social media, traditional and digital media. The questions that they really prompt you through and are part of the toolkit are around how accessible the message is, which channel is going to maximize the message reach, which channels are popular, user-friendly, and trustworthy, how time-consuming and costly is it for you, do you have the right relationships in place, and could you accidentally spread rumors, right? What are the unintended consequences? And I think learning more about channels that folks use or are popular with folks in your community is something that comes up naturally, right? In conversation, in meetings. And so bringing that information back can be helpful. There are strategic ways to frame your message. So there's moral, gain, self-oriented, promotion, prevention, and health consequences. This was new to me. I'm not a communications person. But looking at messaging, I can see how these things have been used. And for me, it was good to think about if I were to do something and I were to think about it in these different ways, what might be best. There is some information in the guidebook about how some of these are better for some audiences than others, but I really liked how they broke it down into these 6 categories. Then with taking action to address rumors. So even if you can't act, address rumors in other ways. So if you decide not to act through like a formal communication, there's still things that you can do, right? So leveraging those strategic partnerships, amplifying trusted or influential voices, attending community outreach events, just your physical presence, and really just being aware of consequences of not taking action. So watching for those, understanding them, discussing them, so that you continue to learn from them is the idea. And then finally, evaluate the messages. So that evaluation step sometimes is hard, right? Because we do the thing and we move on to the next thing. The guidebook really talks about the importance of evaluation, which I think we all know. It's just time, right? So there are different ways that they encourage folks to evaluate messages. So there's user testing and test whether messages are appropriate. Sometimes that can be done right, with those like inoculation messages. Next, track how well you distributed your message and who it reached. There are different ways to do that. And then finally, ask partners about their thoughts on your messaging and its impact on the target audience. If you have if you have relationships or partnerships with folks who are involved with the community that you were trying to address, really understanding from them how did it land? How did it go over? And then there are other things to do, right? In the guidebook, there's a couple of places where it says, what if you could do more, right? Which part of me like hates that pressure is even there because we're doing a lot already. But if you could do more, they talked about key performance indicators or other measures of progress, conducting a more methodical message testing, and then evaluate the extent to which messages have led to short-term or long-term changes, especially in behaviors, beliefs, or practices. These things are not things that are going to happen quickly, right? But they're things that you could build into, kind of start small if you wanted to. But it is extra, right? I want to be sure to point out that it is extra. The last slide here was the resources and further reading that they provided. So Johns Hopkins, this is where a lot of this stuff comes from that I talked to you. The Public Health Communications Collaborative also has a lot of information on miscommunication, rumors. They have their own kind of toolkits, lessons, and then that infodemiology website that I showed you that I thought was pretty cool were the resources that they gave. So I gave you on that Word document a few more specific links from the Public Health Communications Collaborative and a few more links to things kind of within the site that we talked about. And that was what I had prepared from that presentation. There were several slides that I didn't share with you. There was a lot more that she talked about. But those were things that I really picked up on that I felt like applied to kind of what I've been seeing and experiencing, and hope that you have found it interesting as well. I'm happy to take any questions or hear what you all think, what you like, what you don't like, or talk about anything else. If we need or fab questions, any of that, we have a couple more minutes. But just thank you for your time and attention.
Yeah. Thanks, Joy. This was super interesting. Folks, if you haven't been watching the chat, I did put links. There's a link to the document that Joy was referencing quite a bit. And then I put some links into some of the other links that she shared. Also to our YouTube channel page where this video, this recording will be uploaded within a week. Joy, thank you. That was super interesting. And it made me think about the upcoming legislative session, stuff we're seeing out of the federal administration, confusions that people might have about the new food pyramid, when things that are being shared now are different from what they've been shared in the past, and people who are already a little skeptical about public health might see as waffling. And so I think this gives us a lot to think about. I think one of the things is we can't address every rumor. And so how do we pick and choose and how do we use our partners wisely? So that was super helpful. I'd love to hear from other folks who take on rumor busting and see kind of what your experiences are and how that how what Joy just presented kind of meshes with what you're doing. Feel free to unmic and share.
Lena and Joy, this is Leslie Schofield, and as a public health emergency preparedness educator by trade, I found this super valuable.
Yay.
I do an immersion session for brand new emergency response coordinators as part of my day job, and this is a big part of what that includes is messaging and risk communications. But there's so much misinformation and they're swimming upstream constantly that I think this is really helpful to help kind of just serve as a as a guidepost for them and for me because I'm relatively newer to the public health scene in Iowa, and so for me it's just personally advocating within my communities and how I can help educate my friends and community members. So I really appreciate this.
Good. I'm so
Thanks,
glad.
Leslie. And Elizabeth reminded me that these are the types of issues that are discussed in the IPHA social media community of practice. And that is a group of folks who share their social media designs and outputs and again think through these issues and how to best represent public health and truth in social media. So if you'd like to, if you're interested in that group and would like to join that group, again, this is a member benefit. Feel free to reach out to us and we'll get you included. Those meet on Tuesdays. I see Jazzjit. I'm sorry if I mispronounced that.
Oh no, thank you for having me. My name is Jasjeet Gill. I'm actually vaccine field medical director at Pfizer, and I'm covering Iowa. I just joined the vaccine team based out of Colorado. But I want to introduce myself, and I also want to say thank you. And we do have, from the vaccine standpoint, the misinformation, disinformation, and information has kind of been confusing just as far as, so I appreciate you kind of addressing that. And we do have, unbranded resources that kind of talk about vaccine confidence, and that's kind of a new angle that we kind of are using rather than vaccine hesitancy to kind of have a positive messaging. And I think a lot of it is messaging from healthcare professionals. So healthcare professionals um, is one of the strongest indicators of someone actually getting a vaccine. So I appreciate everything you all are doing. But there is also some techniques such as like the three C's, presumptive approaches, ORs, different techniques. And I'd be happy in the future to be as engaged as you'd like me to be or want me to be. So thank you for having me. And I plan on becoming a member.
Yay.
Super, yay.
That's
I,
awesome.
and of
Thank you.
course, I mean, so many of these rumors are around the vaccine space and parental choice and but it overflows into other areas as well. Water fluoridation, you name it. Um,
I put in the Word document, I don't think I talked about this, but I was doing some, end of the year reading. Johns Hopkins wrote about what public health won and lost in 2025. And they said that the questions that we're going to continue into 2026 were how do we harness the power of AI for good? Does Tylenol use during pregnancy cause autism? What will happen with the bird flu? What to do about ultra processed foods and how dangerous is alcohol? So I thought that was just another interesting perspective of the kinds of things we might be hearing and potentially need to be thinking about how we talk about.
yes, great, Joy. We have about 9 minutes left, or I do like to end meetings a little bit before the hour to give people a stretch break. So if anybody has a last comment or question, feel free to add it in. Um, Otherwise, I could thank you again for joining us today. As I've said a couple times, this video or this meeting, this session is being recorded. We'll post that on our YouTube link. And as a membership organization, your membership is important. We are a nonprofit, and we are Iowa's or primary organization, independent organization dedicated to public health advocacy, and we do that work through the donations that we receive through folks, through members and partners.